get comfortable in your chair, put your feet flat on the floor, and bring your awareness to your breath. And if you choose, you can place your hand over your heart and imagine that you're breathing in and out through the heart center. Nothing forced, just an awareness to that part of your body. And then as you do so, I invite you to feel the feeling of love or gratitude for someone or something in your life. Don't think it, but feel it. And then take that feeling and send it out to all your family and friends, coworkers and patients. And send it out to the world. And just notice how that feels. You can place your hand in your lap. You can bring your awareness back to this time and space. And that was just called a quick coherence. And in that quick coherence, in feeling that feeling of gratitude, you've just enhanced the way your heart and your brain communicate.
Welcome to 20-Minute Health Talk. I'm your host, Rob Hoyle, and today our special guest is Deborah McElligott. She's a nurse practitioner at the Center for Wellness and Integrative Medicine at the Katz Institute for Women's Health. Deborah, thanks so much for joining us. Let's just first tell our audience, what is integrative medicine?
Okay, Rob. Well, thanks for having me. And it's interesting. Most people think that integrative medicine is something new, but it really has its roots in holistic medicine from the time of Hippocrates. And the roots of it also align with nursing. So it's an approach where we look at the whole person. There's a focus on healing. There's a focus on relationships and partnerships. And it aligns with the field of integrative health, which is really an exciting time where we are now, where we take the best of our conventional medicine, all the surgeries, the research, the best practice models, and then we take the complementary and alternative therapies that have been around for thousands of years, but then we add a whole focus on self-care. So those three components, the alternative medicines, the conventional medicine, and a huge emphasis on healthcare, really combines to form what we call integrative health, and that integrative medicine supports.
That's so awesome. Tell me a little bit about your role at the Katz Institute for Women's Health.
So it's interesting. My title is nurse practitioner, so most people think I'm, assessing and diagnosing and treating, but I'm a holistic nurse practitioner in New York State, and I've been with the health system since 1988. And the role at Katz really allows me to combine the best parts of my previous roles as a clinical nurse specialist, nurse practitioner, director, faculty at the School of Medicine. And from those roles, I'm able to create integrative programs, do integrative modalities and therapies with people, and develop trainings for our staff and for the community, because we're looking to expand this throughout the health system.
So how did integrative medicine help women during COVID-19?
So the focus of integrative medicine, again, is this whole person healing and healthy lifestyles. And we know that the number one killer of women is heart disease, followed closely by cancer, and then COVID-19. So during this time, we continued our focus on women's health and looking at risk factors. We offered our 7-week programs trying to help women modify their risk factors. And this was a time when they were having many virtual visits with their healthcare providers, and they were really putting their self-care on a back seat. And with integrative medicine, it highlighting the importance of self-care really empowers women and almost gives them permission to take care of themselves. And we know that by addressing risk factors for heart disease and cancer, you also decrease your risk of death from COVID, because those were closely linked. So we had a huge focus, aligning really with Katz Institute for Women's Health on those two areas, which had been our focus for a while, but it had new meaning during the COVID crisis. And I think women really needed that permission to, with so much going on, I still need to focus on myself, make sure I contact providers, make sure I'm taking the right medications, and do some practices that keep me moving, eat some foods that are healthy, and find this support within our group so that they can help to relieve stress.
Yeah, I think everybody's lifestyle, and especially with this COVID pandemic, there's been so much stress, right? There's been so much stress and unknown. How much does stress play a role in bad health?
Stress plays a huge role, and it's something that we've honored in, I would say, maybe the last 10 or 15 years. My background's cardiac surgery. So my first introduction to integrative therapies came from my cardiac patients being stressed. And 30 years ago, people would say, oh, it's just in your mind, get over it. Now we recognize that the toll that stress takes on the body, on the mind, on the spirit, and how it connects to inflammation and pretty much any disease process that you have, stress can make worse. So we really look to see how people identify stress, where they hold it in their body. And this is the conversation. And this goes back to the person where they tell us how stress manifests in them. And we work with them to identify their cause and then develop a plan on what they want to do to relieve it. I usually say there's no quick fix, yet a number of the integrative modalities can make you feel relaxed very quickly. And while we offer acupuncture, massage, reflexology, the modalities that can really help people relax quickly, we encourage the self-care practices of meditation, self-Reiki, even self-massage and reflexology, so that people walk away with skills. That's not that they just come to us to be fixed. They walk away with skills in self-care that they can incorporate into their lifestyle and into that of their family. So it's really the partnership that we have with the people and putting the onus back on the person that, they're the ones responsible for their health, but we're here to partner with them. We're here to guide them. Gone are my days of the NP giving them the list of do's and don'ts. And then when they come back for their visit, checking, did you do this or didn't you do that? Now it's the coaching approach, focusing on their health and well-being and giving them the many opportunities that we have at the Center for Wellness, many integrative therapies, and not forgetting about their conventional medicines, their conventional treatments. Those are powerful too. And it's this partnership between us and the wonderful services we have available in the health system and the women themselves that makes it so powerful and so unique. This is something that isn't happening in every hospital across the country. When I looked years ago for integrative centers, there were a few across the country, but they didn't last long because they weren't revenue generating. So my wish became a reality really when Katz Institute offered us this opportunity to create the Center for Wellness and Integrative Medicine. So we are quite unique.
How do we help ourselves to relax, to reduce stress?
It starts with identifying it, and the decision to really want to do something about it. We can be stressed by the way we think. We can be stressed by what we look at. We can stress ourselves by the foods we eat and the relationships that we have. So it's not just one thing. It's often a culmination. And we usually say it's this allostatic load, this buildup of everything that's going on that sort of tips us over the edge. And then we just say, oh, I'm stressed. And it's usually a combination of a lot of different things. So on the other hand, we try to focus on building resilience. And that's sort of like the key word now, how do we build resilience in ourselves? And that's where the integrative medicine, integrative health and lifestyles really come into play. We want to develop that response. So we often ask people to, do a daily practice of 5 or 10 minutes where they're focusing on their breath. And then when you need it, you can call on it and that will trigger that response, that beginning of a relaxation response for you.
What about somebody who's listening and says, I just do not have enough time in my day to do a meditation, and maybe you're thinking that a meditation has to be like an hour long?
There's a joke about that. I know Dr. Stern's mentioned it many times. If someone says, oh, I don't have a half hour to meditate, you probably should be meditating 2 hours or 3 hours a day. So we don't have time. We're very busy. Probably if our neighbor or somebody asked us if we could do something for them for 10 minutes, we drop whatever we'd have to do and we do it for them. So what does it take to make that 10 minutes, or take that 10 minutes for ourselves? Why can't we do it? I think when we look at some of the research and we see the benefits of these age-old practices, from meditation to yoga to Tai Chi, and they can physically prove this on a functional MRI that we can enhance the gray matter in our brain or increase our telomeres. The huge physical effects that these practices can have are huge. It's almost, I laugh, I say, if I listened to my grandmother, I would have been doing all these things years ago, between prayer, meditation,